Children who are in a mental health crisis often need a physical place to go where they can be surrounded by professional support. One such place is a Crisis Stabilization Unit. Here with us to discuss what the program is and what it's all about is Sweetser's Chief Program Officer, Kristie Worster. Kristie, thanks so much for coming in and being with us to talk about this important topic. For those who don't know, what is a Crisis Stabilization Unit and who does it serve?
Sure, yeah, thank you for having me today. So a Crisis Stabilization Unit, also known as a CSU or a Crisis Residential Unit, is a safe home-like place where children can come that are struggling. Generally, kids are 7 to 17 years old. We have a kitchen, living room, dining room, bedrooms, and folks really work in a group therapy setting with behavioral health professionals. They get individual therapy from a master's level therapist there, as well as family treatment to make sure that kids are able to go home safe. And generally speaking, kids are there from anywhere from 3 to 10 days.
Mm-hmm. Sounds like a lot of support. Why would children need a program like this?
Yeah, it's a great question. So a crisis in the state of Maine is really something that is self-defined. So for children or adolescents, oftentimes they're struggling with anxiety, could be panic attacks, depression, sadness, however they define that. Sometimes kids are struggling with having some suicidal thinking, and that's something we obviously really want to target. So we offer them a place where they can come and be safe, because the parents may not be able to feel as if they can do everything, and that they may need more than just a traditional therapist or case manager, but they're not quite in need of a hospital setting.
Gotcha, okay. So who would be taking care of the children when they're at this unit or in this unit, and how many children specifically can you guys help?
Absolutely. Well, we have two Crisis Stabilization Units. One is in Rockport, and that is an 8-bed unit, so eight children or adolescents can stay there. And we also have a brand new refurbished unit in Saco that we just opened this week, and that also has the ability to serve 8 children or adolescents at a time. And we have behavioral health professionals that take care of the kids as well as the therapists, but basically 24 hours a day.
Wow.
We have anywhere from 2 to 6 staff there taking care of folks and helping the families and the adolescents and children. And we're really excited about both of these units, but our Saco unit is a trauma-informed unit. It was an opportunity to kind of look at everything from the entryway and the colors of the unit to the way that we approach treatment with the most up-to-date trauma-informed care.
So a lot of thought goes into this, it sounds like.
Yes.
Say there's a family out there watching this segment right now. What should they do if they feel like their child is in need of visiting one of these units?
Yeah, absolutely. So referrals to the Crisis Stabilization Unit go through the Maine State Crisis Line, or the 988 number. Generally speaking, if families or parents or other folks are struggling, they want to first have their case manager or their therapist, primary care, refer them. Sometimes kids are coming from a hospital stay to the unit. But if they were going to self-refer, then what would happen is they would meet with somebody from that crisis line or from mobile crisis just to assure that they're getting the right level of care if a parent is concerned. So we always make sure that they are in the right place and that they're getting the right care. We also work with therapists and case managers for kids that already have those services, and if they don't, we're making referrals. So.
Okay,
Yeah.
very good. Kristie Worster, thanks so much for being here to talk about this important subject with us today. We appreciate your time.
Thank you so much.